Gout in the elderly is the result of uric acid accumulation in the blood, leading to the formation of urate crystals deposited in the joints, causing inflammation and pain. Below is a more detailed analysis of the causes of gout in the elderly, with a clear explanation of the mechanisms and factors involved. *1. Decreased kidney function due to aging. Mechanism. The kidneys play a major role in filtering and excreting uric acid through urine. With advancing age, usually over 60, the number of nephrons, the filtering units of the kidneys, decreases, reducing the glomerular filtration rate (GFR). This causes uric acid to not be excreted effectively, leading to increased blood levels. Hyperuricemia. Specific impact. In older adults, GFR can decrease by 30 to 50% compared to younger people, making uric acid accumulate more easily. This condition is especially serious in people with chronic kidney disease or a history of glomerulonephritis. For example, a 65-year-old person with a GFR of 50 milliliters per minute compared to 90 to 120 milliliters per minute in a younger person is at high risk for hyperuricemia, even if the diet is not too rich in purines. Related factors. Dehydration due to drinking little water or taking diuretics causes concentrated urine, reducing uric acid excretion, further increasing the risk. *2. Unhealthy diet. Mechanism. Purine is a natural compound found in some foods, which is converted into uric acid in the body. Older people often maintain long-standing eating habits, including purine-rich foods or drinks that increase uric acid. Related foods and beverages. Foods rich in purines. Organ meats: liver, kidney, intestine, red meat, beef, pork, seafood, sardines, herring, shrimp, crab, some vegetables, mushrooms, asparagus, spinach. Alcohol. Beer contains a lot of purines from yeast, which also reduce uric acid excretion through the kidneys. Strong alcohol, whiskey, rice wine also increases uric acid. Older people, especially men, may have a long-term drinking habit, increasing the risk. Fructose-containing beverages, soft drinks, fruit juices, or syrups containing fructose increase uric acid production through liver metabolism. Specific impact. A meal rich in purines, for example, seafood hot pot with beer, can increase uric acid by 10 to 20% within a few hours, enough to trigger an acute gout attack. Older people often have fixed eating habits that are difficult to change, leading to a high risk of gout recurrence. For example, a 70-year-old person who regularly eats beef and drinks beer every week may see uric acid levels increase from 6 mg DL to 8 to 9 mg DL, exceeding the threshold for urate crystal deposition. 3. Underlying diseases and treatment drugs. Mechanism. Many common diseases in older adults affect uric acid metabolism or excretion. Some drugs used to treat these diseases also increase uric acid. Related diseases. Hypertension reduces blood flow to the kidneys, hindering uric acid excretion. Type 2 diabetes. Insulin metabolism disorders increase uric acid production and decrease excretion. Lipid disorders. Increased triglycerides and cholesterol increase the risk of gout. By affecting purine metabolism. Chronic kidney disease. Decreased kidney function, leading to uric acid buildup. Metabolic syndrome. The combination of obesity, hypertension, diabetes, and dyslipidemia increases the risk of gout 3 to 4 times. Drugs that increase uric acid. Diuretics. Thiazides such as hydrochlorothiazide, furosemide, reduce uric acid excretion through the kidneys. Often used to treat high blood pressure or heart failure. Low-dose aspirin 75 to 100 milligrams per day. Often used to prevent stroke or heart attack, but reduces uric acid excretion. Chemotherapy or immunosuppressive drugs cyclosporine. Tacrolimus, used in cancer treatment or transplant. Increase uric acid by destroying cells or affecting the kidneys. Specific impact. Thiazide. Diuretics can increase uric acid by 1 to 2 milligrams (dl) for several weeks. Older adults often take multiple medications at the same time, increasing the risk of drug interactions and uric acid buildup. For example, a 68-year-old person taking diuretics for high blood pressure and low-dose aspirin to prevent stroke has a 50% higher risk of gout than someone who does not take these medications. For obesity and sedentary lifestyle. Mechanism. Excess adipose tissue increases uric acid production through the purine metabolism pathway. A sedentary lifestyle reduces blood circulation and uric acid excretion, while increasing systemic inflammation. Specific impact. Obese people BMI greater than 30 have a 2 to 3 times higher risk of gout than people of normal weight. In older adults, decreased muscle mass. Sarcopenia reduces energy metabolism, indirectly increasing uric acid. Lack of exercise reduces circulation to the joints, creating conditions for urate crystals to deposit. For example, a 65-year-old person with a BMI of 28 who is sedentary due to joint pain or fatigue may see uric acid increase from 6 milligrams (dl) to 8 milligrams (dl) over several months. 5. Genetic factors. Mechanism. Genes that control enzymes involved in purine metabolism, such as xanthine oxidase or renal excretion of uric acid such as the URAT1 gene, may increase the risk of gout. Specific impact. If a parent or sibling has gout, the risk in older adults increases by 20 to 80% depending on the number of relatives with the disease. Some ethnic groups such as Asians, Polynesians have higher rates of gout due to genetic factors. For example, a 60-year-old man whose father had gout has twice the risk of developing the disease as someone with no family history. How to treat gout in the elderly. Control gout. Older adults need a combination of lifestyle changes, medical treatment, and regular follow-up. Here are the detailed measures. 1. Change your lifestyle. Healthy diet. Limit foods rich in purines. Avoid organ meats: liver, kidney, stomach, red meat: beef, pork, seafood: sardines, herring, shrimp, crab, mushrooms, asparagus. Reduce lentils, peas, spinach. Increase beneficial foods. Fruits rich in vitamin C: oranges, lemons, guavas. Kiwis help reduce uric acid. For example, eating 500 milligrams of vitamin C, day equivalent to 2 to 3 oranges, can reduce uric acid by about 10%. Green vegetables: cabbage, broccoli, cucumber, whole grains, low-fat dairy, and nuts: almonds. Walnuts are low in purines and support overall health. Drink enough water. Drink 2 to 3 liters of water, day. Filtered water, mineral water, or unsweetened herbal tea to increase uric acid excretion. Avoid sugary soft drinks or syrups containing fructose. Limit alcohol. Avoid beer and spirits completely. Red wine can be consumed in very small amounts, 1 to 2 glasses per week if your doctor allows it. Weight control. If you are overweight, lose weight slowly, 0.5 to 1 kilogram per month with a healthy diet and exercise. Avoid fasting or rapid weight loss, as this can increase uric acid and cause acute gout attacks. For example, a 70 kilograms person with a BMI of 28 should aim to reduce to a BMI of 23 to 24 in 6 to 12 months. Exercise regularly. Gentle exercises such as walking 20 to 30 minutes a day, yoga, cycling, or swimming help improve circulation, reduce inflammation, and maintain weight. Avoid exercises that put stress on the joints, such as heavy jogging, weightlifting during an acute gout attack. Avoid stress. Stress can trigger a gout attack. Practice meditation, deep breathing, or engage in relaxing activities such as reading or listening to music. 2. Medical treatment. Uric acid control drugs. Allopurinol reduces uric acid production. Usually used long-term. Low starting dose 100 milligrams per day and gradually increased as directed by your doctor. Febuxostat, alternative to allopurinol if not tolerated. Highly effective but liver function monitoring required. Probenecid increases uric acid excretion through the kidneys. Only use when kidney function is good. Note: do not start or stop uric acid control medications during an acute gout attack, as this may make the condition worse. Medications for acute gout. Colchicine. Use early, within the first 24 to 48 hours. When an acute gout attack begins, low dose 0.6 milligrams, 1 to 2 times a day to reduce pain and inflammation. Non-steroidal anti-inflammatory drugs, NSAIDs, ibuprofen, naproxen, or indomethacin help reduce pain and swelling. Avoid use in people with stomach problems or kidney failure. Corticoids, prednisolone or methylprednisone oral or injectable, are used in severe cases or cases that do not respond to NSAIDs. Colchicine. Note: always use medication as prescribed by your doctor, especially in the elderly, due to the high risk of side effects: gastrointestinal bleeding, kidney failure, management of underlying disease, good control of related diseases such as high blood pressure, diabetes, or dyslipidemia with medication and lifestyle. Replace thiazide diuretics with other drugs such as losartan if your doctor judges it appropriate, because losartan has the side effect of helping to lower uric acid. 3. Monitoring and prevention. Periodic check. Measure serum uric acid levels, target below 6 milligrams (dl). Renal function, creatinine, eGFR, and related parameters. Blood glucose, blood lipids every 3 to 6 months. Urine test to assess uric acid excretion. Avoid self-medication. Certain medications such as low-dose aspirin, diuretics, or chemotherapy drugs can increase uric acid. Always consult your doctor before taking them. Joint protection. During an acute gout attack, avoid strenuous exercise or putting pressure on the affected joint, usually the big toe, ankle, or knee. Elevate the swollen joint, for example. Put your foot on a pillow when lying down to reduce pressure. 4. Support measures. Cold compress. Use an ice pack wrapped in a clean towel and apply it to the swollen joint for 15 to 20 minutes. Time: 2 to 3 times a day to reduce pain and inflammation. Rest. During an acute gout attack, rest completely and avoid moving around too much. Use supplements if needed. Some products containing cherry extract or vitamin C may help reduce uric acid, but consult your doctor. Important notes: individualize. Treatment. Older adults often have many underlying diseases and take many medications, so they need to see a specialist endocrinologist, musculoskeletal specialist for advice on an appropriate regimen. Do not stop taking medication on your own. Uric acid control drugs such as allopurinol need to be used long-term even when there are no symptoms, to prevent gout attacks from recurring. Family education. Relatives need to help older adults follow a diet, drink enough water, and take medication on time.